Hi, guys, it's Dr. Sadaf, and I would love for you to like and share this podcast and make sure you leave me a review. I'd love those 5 stars. So please, when you send me a review, please make sure to put the 5 stars in and to share the episode with somebody that you know that could really use it. And I would absolutely appreciate it. Also, if you're looking to schedule an appointment with me, make sure you go to my email and put your name on the email list. You will be the first to know when I open up my office in spring of 2024. It's drsadaf.com. And last but definitely not the least, September 16th to the 23rd, 2024, I will be hosting a retreat with Dr. Basma Faris in Morocco. You will be getting yoga and coaching, and we'll be doing excursions and cooking and spa and hammam and all of that great stuff along with meditation. So make sure you don't miss out. Spots are limited. So go to the link in my bio in both Instagram and TikTok to make sure you register. Enjoy the show. I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodhi, and this episode is everything you need to know about gut microbiome. But before we get into it, one thing I want to make very clear is that I'm not giving any type of medical advice and definitely not giving any type of religious advice. So if you're having any questions about your health, please see your friendly neighborhood healthcare provider. And any questions about your religion, please speak with your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So I am super excited to have on with me today Dr. Alicia Robbins. Welcome, Dr. Robbins.
Hi, thanks, Dr. Sadaf. So happy to be here.
And Dr. Robbins is a gynecologist, just like I am. So please, for those viewers and audience members that may not know you, please introduce yourself.
Yeah, absolutely. Hi, everyone. I'm Alicia Robbins. I am a board certified OBGYN. I'm also board certified in lifestyle medicine, which is sort of the study of nutrition, movement, exercise, stress reduction, and overall lifestyle. And then also a certified menopause practitioner. I did all my training in New York City at Mount Sinai. I worked there for a few years and then moved to Connecticut, where I worked for another 5 years doing general obstetrics OBGYN. And then the last year transitioned out into really focusing on gynecology, lifestyle, menopause, perimenopause. And I opened my own practice called The Elm, which I called The Elm because I wanted it to sort of reflect the holistic sort of approach that I have in terms of lifestyle and medicine. And so this is a topic that I love talking about, that I love reading about, that I think is really going to be so interesting to see how much research comes forth. I mean, there's so much research coming out now, but I just think there's so much potential for improving health span and prevention with the knowledge that we are gaining about the microbiome. So I'm excited to talk about it.
Yeah, well, I'm so excited to have you on because this is definitely a very novel topic that
Yes.
more and more research is coming out on, and we definitely don't know very much about it. And, I was just talking a little bit offline that I had somebody ask me about the connection between gut microbiome and specifically menopause. And I looked at her like she was crazy. I was like, I don't know what that can you talking about? And then after I spoke with you, I was like, oh, I guess there is a connection. I had no idea. So I'm so excited to learn all about it.
Yeah. So maybe I'll just give sort of a general, define a few things just so people understand what we're talking about, because you hear kind of a lot of these terms thrown out. So basically, a microbiome refers to the collection of bacteria, fungi, and viruses that are living organisms that are found in a particular environment. So, we usually, when people are talking about the microbiome, a lot of times they're talking about the gut microbiome, because that seems to sort of be the biggest microbiome on our body. But we actually have a microbiome on our skin. We have a vaginal microbiome, which we can talk about in a little bit. But the gut microbiome is sort of like the main engine. And, sort of as you had alluded to in the past, where we didn't, at least when I was in medical school, this was not really a topic that we talked about. And we sort of thought about systems separately, sort of, you have your endocrine system and estrogen is doing this thing. And then you have your GI system, it's doing its digesting. And you have your nervous system and mental health, and that's one, axis. And we didn't really understand that they are all so intricately connected. And so we're realizing that more and more, that basically the microbiome in our gut is very involved in hormonal regulation, in neuroregulation with neurotransmitters in our brain, and is very involved in inflammation, chronic disease. So basically, the microbiome is the collection of bacteria, virus, and fungi in your gut, basically starting from your mouth down to your anus, that are active living beings that influence metabolites and hormones in your whole body. Okay. So, specifically, and I think this is interesting. The other thing that's important to think about is sort of, if you think about it from an evolutionary perspective, thousands of years ago, we were probably exposed to a lot more bacteria because we were outside more, we were in nature, we didn't have antibiotics. We, had more of a diverse exposure to food. And so what sort of happened, and why this has become a topic that we've realized that is so important to address, is that, fast forward a few thousand years, the Industrial Revolution happens, modern society exists, and next thing you know, our bodies really haven't been able to adapt fast enough to the amount of processed food that we have, the amount of antibiotic use that we, of course, sometimes needed, but we tend to use a lot of antibiotics, which clean out the diversity of your gut. We also, that we live in a society where there's just chronic stress all the time. A few thousand years ago, we'd have acute periods of stress where for a few hours, perhaps we were very stressed, and then it would go away. It was sort of acute stresses. But now we live in this we have this baseline level of chronic stress that definitely is involved in chronic disease. Like, we realize the importance of sleep and chronic stress in elevated cortisol levels and in chronic disease. So basically, we sort of quickly, we after the Industrial Revolution, we have found ourselves in this modern society where we're eating a lot more processed food that really isn't actually real food and doesn't support a microbiome, or eat a lot more sugar, which tends to encourage sort of bad bacteria to grow. And I should make that clarification too. Like, in the gut microbiome, there's trillions of different types of organisms, and they need to be balanced, because when you have what's called dysbiosis, which just basically means you have overgrowth of or an imbalance of certain type of bacteria, there are bad bacteria and there are good bacteria. And so when we sort of live a lifestyle where we're eating processed food, a lot of sugar, chronic stress, sedentary lifestyle, inside all the time, hygiene is obviously important, but we've almost gotten to a point where we have so much hygiene and so much antibiotic use that we have found ourselves with less diverse microbiome than we think we had thousands of years ago. And so there's all this sort of research showing that, like, the more diverse you can make your microbiome, the better it is for regulating your hormones and neurotransmitters and overall health. As it pertains to women, it's so interesting because there's within the microbiome, your gut microbiome, there's an area called the estrobolome. And the estrobolome is a group of bacteria that actually help metabolize estrogen and help it to get reabsorbed. So normally what happens, your ovaries secrete estrogen, it is secreted into your bloodstream, goes around your circulation, and it's a chemical messenger that has receptors all over your body, in your brain, in your, reproductive organs, but also your skin, your hair, everywhere. And then excess estrogen is metabolized in the liver and then gets resecreted into your gut. And interestingly enough, I think previously we always thought that that extra estrogen that was metabolized or conjugated was just excreted. Now we realize that actually a good portion of it, maybe even a majority of it, gets reabsorbed
Hmm.
by the estrobolome, specifically this enzyme called beta glucuronidase. And it doesn't really matter, no one needs to remember that, but you'll probably be hearing a lot more about this enzyme in the future, because this is the one enzyme, beta glucuronidase, that is responsible for reabsorbing the estrogen back into your circulatory system. So there's so much that alone. There's like so much interesting potential for like how can you increase beta, glucuronidase levels, whatever. Like, and so what we see in women is that the gut, well, and starting at birth, the gut microbiome really changes and becomes diverse once a baby is weaned from breast milk to solid food. And then between male and female babies, it's sort of similar until puberty. And what we see happens in puberty is that girls' GI microbiome becomes more diverse. And so we know there's some correlation with estrogen. We know that estrogen helps to support a diverse microbiome, and vice versa. Microbiome helps to support estrogen. So we see starting at puberty, when women start having estrogen secreted from the ovaries, that there is a difference in gender. And then so throughout the reproductive life of a woman, her microbiome is generally much more diverse than a men's. If you compare and then try to control for other variables, women tend to have a more diverse microbiome than men until menopause. So it's interesting. So then when menopause happens and the estrogen starts to decrease, their microbiome is more similar to that of a man's and is less diverse. So for sure, there's this like interesting sort of symbiotic relationship between estrogen and the microbiome. That was like a really long overview, but
That's amazing. I had no idea. And, I guess a lot of the things in women, right, tend to become more similar or androgenic as women move toward menopause without the estrogen, right? Even like we start to get the android shape of our bodies where we start to
yeah,
gather more fat around the midsection and
yes,
right we notice that we start to lose some hair, and so there's a lot of
yes.
androgenic effects that happen in menopause, and so all the more reason why hormone therapy is so important for a lot of the functions in our bodies. And so, I guess I'm just so curious about this microbiome in the gut that helps to metabolize the estrogen. And so you said that it seems that the gut microbiome in puberty, after puberty, starts to become more diverse and then the diversity goes down after menopause. So it really seems like those reproductive years, or where we have a lot of the estrogen, is where I don't know, where the basically that gut microbiome is being maximized, right?
Altered, yeah.
That's where
And oh, sorry.
no, I was just going to say that seems to be where the most diversity is during that time.
Yeah. And you also see differences in different GYN syndromes or disease states like endometriosis and PCOS. So interestingly, women with endometriosis and PCOS have more dysbiosis, I guess, so more
Mm.
imbalance. Specifically, I actually don't remember the specific. There's studies which will show like women with endo tend to have more elevated levels of XYZ bacteria, and how you know whether that sort of was the initial, it's hard to almost tease out like which came first, but they definitely influence each other, and so we definitely know there's some kind of connection between not only high estrogen and low estrogen states, but also um, having having disease or pathology states like endometriosis, or high inflammatory states like endometriosis and PCOS, and perhaps even fibroids. Um, and so, the sort of, and then you can get into there's a study of like phytoestrogens and food that you eat, because basically the way to make your microbiome more diverse is eating a more diverse plate of food. It's like the more variety of colors, food, vegetables, spices, grains that you eat, it helps ensure that you're getting the variety of nutrients, phytochemicals, and antioxidants that are available. And so the more diverse things you eat, the more chance that you'll be able to increase your microbiome and have the downstream positive effects. Yeah.
Yeah. So I'm wondering, so you're saying that the more diverse your gut biome is, so is that, I'm curious to know if that, helps in the metabolism of the estrogens. You're able to take up more estrogen in your body. And when you said that, syndromes such as PCOS and endometriosis, they cause a dyssymbiosis in your
Mm-hmm.
gut. Does that lead to a decreased absorption of estrogen? I wonder. I don't know if that
Yeah.
there's a correlation or not.
Yeah. It's not clear, like, whether, you know, whether it's sort of the alteration of beta glucuron. As far as I'm aware, I don't think we understand yet exactly what the sort of mechanism is for having like a high estrogen state. But for sure, like, yeah, I don't know. I honestly don't know, like, you know, if we can really pinpoint what how to manipulate it in a way to, you know, treat those diseases with diet. I don't think that we're there yet, but I think that it's a place that we might be in the near future. I mean, I have patients sometimes ask me, like, where if I eat, because you hear about like the phytoestrogens in food, and like if I eat more soy, will that help with hot flashes or decreased estrogen states? And the reality is not that clearly, because if it did, we would definitely know. Like if we could say, oh, you eat like 10 yams a day, you'll have a decrease in hot flashes. Now there are some studies that show that, but it's not a very clear, it's not the evidence is not super clear. And the thing about phytoestrogens, which are basically food that mimics, and the estrobolome is involved in producing these phytoestrogens. These phytoestrogens are found in foods like soy, tempeh, lentils, legumes, and flax seeds. And so when you eat that food, some of it is converted into metabolites and products that are somewhat reflective or look similar to estrogen. The thing is, depending on the woman, every woman is different. By the way, every single person has a distinct microbiome. There's not one person who has the exact same microbiome. It's like a fingerprint. And so when someone eats it, so the short answer is it really depends on the person. Everyone's different. And so some women, if they eat phytoestrogens, it depends on the receptor, like the way their body reacts to how sensitive they are to a phytoestrogen or to the real estrogen, because a phytoestrogen can act like pro-estrogenic or anti-estrogenic. For instance, if a phytoestrogen is attaching to the receptor instead of your actual estradiol, it's going to have an anti-estrogen effect. And so that really depends on person to person. So and there's definitely no harm either. Like you can absolutely, these foods are very, very safe. They don't increase your risk of breast cancer at all. But when people ask me, will I get relief from hot flashes from eating food? It's hard. There's not that clear of a link. It's not that simple.
Yeah, you'd probably have to eat like a lot of it.
Yeah.
Probably more
And you'd
than
have to eat a lot of it, and you'd have to hope that your receptors bind to that,
right.
And
Right.
and it doesn't act sort of in an antagonizing way.
Right.
But it's fascinating how all these systems are connected. The other thing that can really help increase the diversity of a microbiome, which by the way takes about a couple weeks to see improvement. The more vegetables, the more diversity of food that you're eating, even like the soil in which the food grows matters, because generally soil that is not the type of soil used in like industrial farming has more microorganisms and bacteria. And that is good in terms of eating those vegetables and being outside and getting that sort of variety of microorganisms in your gut. But basically, one, interesting thing and sort of doable thing is like the more diverse of vegetables that you eat, it only really takes a couple weeks to start seeing a shift in your microbiome.
Mm.
And so it's doable. It doesn't take years. It is possible to change that with your diet. The reason you'll hear like a lot of emphasis on fermented foods, um, like sauerkraut and kimchi and kefir and stuff like that, is that those foods have been fermented to have live cultures and a high amount of live cultures. So they're just like a really effective way of introducing bacteria, even more than probiotics, for example, like a probiotic pill. Like it's, if you were to eat more real food and more fermented food, that's like a really effective way of increasing and improving your microbiome.
That's amazing. I had heard of that actually. There's somebody that I follow on Instagram, and she talks about the K foods. So she talks about like kiwi,
Yeah.
kombucha, like kimchi.
Yeah.
And I was like sauerkraut, and I was like, I wish I liked like half of those foods. I
I
tried
know. I know.
kombucha, and I was like, what is this?
I know. I like sauerkraut. I'm trying to put it on more things, I mean, I'm also not, none of them. Yeah, a lot of cultures in Asia and Europe do use more fermented foods, but in America, it's just not something we're that used to. And so, the standard American diet really just doesn't have any fermented food. So it's an acquired taste for sure.
Yeah.
But sometimes just knowing the benefit makes it a little bit more palatable.
Yeah, right. So, I'm wondering if, of course, I would think that increasing the diversity in your gut microbiome would probably decrease a lot of symptoms that maybe women feel during PMS and during their period, right? With the cramping, the bloating, the
Yes.
abdominal distension. I'm thinking that probably having a good gut microbiome would probably be helpful.
Yes. Um, because you see, and it's definitely involved in, of course, the estrogen metabolism, but basically, fiber is really important for women in reproductive age and menopause. Fiber, when you eat fiber, it is converted into short chain fatty acids, and these short chain fatty acids are actually modulated, help to modulate a lot of these hormones, including one called GLP-1, which is like a lot of people have heard of these GLP-1 agonist medications like Ozempic and Mounjaro. So you actually can increase your natural production of GLP-1 by eating more fiber. And that's why you get that sort of more sensation of satiety with eating more fiber. But that is really helpful in terms of glucose metabolism. Now, if you're not used to eating fiber, eating a lot of it at once can not be fun. And so you kind of have to sort of get used to eating it more and more. Um, but but that is really important, sort of dealing with a lot of the fullness, bloating, bowel regularity, and then mood as well. Like there's some studies. I don't know if you're familiar at all with Dr. Michael Greger. He wrote the book How Not to Die, and
Yes, I have that book.
oh yeah, and he writes a lot. There's a whole chapter dedicated into how like the antioxidants in food, like turmeric and berries and are actually used in the serotonin pathways in your brain and can be helpful for mood. And so that's incredible. Like that, like the food you eat. I remember in medical school, like we were never really taught how directly related like your nutrition and food was to your overall health. I remember asking a professor one time if like nutrition affected acne at all, and they were like, no, not unless you're like rubbing chocolate on your face. That's literally what they told me. But
That's not true.
no, yeah, and now we realize like it's so important
Yeah.
because it has such downstream effects in terms of, this idea of like anti-inflammatory states, an anti-inflammatory diet and an anti-inflammatory. The idea is basically that, well, like I was saying, we have this chronic stress. Basically, from after the Industrial Revolution, we were exposed to a lot more artificial or preservatives or sort of foreign things that your body saw as foreign. And our immune system is set up to sort of attack things that look foreign to protect us from them. And so when we start exposing our gut to a lot of preservatives and our processed things and things that just aren't really like found in nature, you end up having this sort of chronic inflammatory state where your immune system is just up, like heightened at all times. But that over the long term is not good for us. And estrogen tends to be anti-inflammatory. So like they've done some studies which show that like they've done some studies that show that in postmenopausal women, there are like more inflammatory cells like lined up throughout the gut just because of that lack of estrogen that's being circulated around.
That's really interesting. And I guess because also during menopause, the gut microbiome changes, I would assume that that's probably why you get a lot more bloating, discomfort, right? Perhaps there's more production of gas. I don't know. All of those things, I guess if our gut microbiome is changing, then,
Yeah.
how
And then the next, like the sort of natural next question one wants to know is like, well, does hormone therapy change your gut microbiome? Like, will that help maintain a diverse gut microbiome? And it appears that yes, it does. There are not big studies. This was done actually on surgically induced rodent mice that were sort of surgically placed into menopause, who were given HRT and were found to have their gut microbiome went back to being more diverse as they were after they were supplemented with estrogen. And then they did I think I found like a really small study where they did this with women by after eight, but it was a really small study, like maybe like 30 women or something. So I don't think we can make any large conclusions, but at least in mice, it does appear that repleting someone with estrogen helps maintain their microbiome.
I'm just imagining the study, like taking the ovaries out of these mice and then
I
making
know.
them menopausal and then giving
These
them
poor mice. I know. I mean, it's so, yeah, it's, yeah. And then, this whole, I mean, this is not my area of expertise is not in like stool sampling and stuff, but there's this whole area of like where you do like really expansive, interesting stool samplings to test different types of bacteria and your percentage of, this and that. And it really, I think it's going to be very interesting because I think it has a lot of potential for potentially manipulating that, maybe in a good way,
Yeah, I think that, you bring up a lot of important topics, right? One is that what we eat really directly affects our health. And I think we all know that peripherally, but to really understand what it's doing to the gut microbiome, there's another reason why you should have multiple colors on your plate in terms of like vegetables and fruits and all of this stuff, right? And just seeing how all of that plays into our hormones and how we feel, I think, mood, all of that.
Sometimes it's hard to tease apart, but I do think, I've in my study of one woman myself, like when I have tried really hard to like eat clean and eat a diverse amount of vegetables and incorporate a little bit of sauerkraut here and there and lots of spices and things, I do feel better. Now, like, is part of it because I'm also exercising at the same time? And that all helps, but I really do feel, that I feel lighter and happier when I eat healthier. Not to say I am, listen, I actually am a sort of historically have been like a junk food lover. So I do, you know, I'm I'm only, I'm not here to give women one more thing to do in terms of like, oh, you have, but it is more interesting and sort of more motivating to eat healthy when you see that there's real correlations with health. I just started reading the book by Dr. Lisa Mosconi, the not her ex book, but I think it's called Brain Food, and it's a whole book dedicated really in terms of like dementia and Alzheimer's prevention from nutrition. So
Amazing.
yeah, it's so interesting.
Right, right. Yeah, no, I think that it's everything is so interconnected and intertwined that I think it's really important to have somebody like you that, can tease apart this information and see how it applies to a person's own life, right? I think that what you talk about is really exciting to look into the future and see how the gut microbiome perhaps can assist menopausal women in really absorbing that estrogen that we know is so important as we get older, and to help with cardiovascular, right? With our cardiovascular system, with bones, with our brain, with just everything is so interconnected. So I think it's going to be really fascinating to see where this research goes and how it really improves women's lives.
And I think what you said is so important. And I would say, like, I think one take home point is that I mean, yes, look, I'm a big fan of hormone therapy for women, but I think, when we see that the female microbiome matches that of a man during menopause, and then her risk of cardiovascular disease matches that of a man in menopause. Of course, I would support hormone therapy, but not, and most women are candidates for hormone therapy, and not everyone. And I think the important message is that this is a time when nutrition and lifestyle become even more important, because if you choose not to do, or you're not a candidate for hormone therapy, prioritizing your nutrition to
Mhm.
compensate for that cardiovascular risk is really important. So, because women, that's the number one, I feel like we hear, we forget that that is like the number one cause of death for women, cardiovascular disease, and that your risk jumps at menopause. So if anything, and I think that's another thing, it's like, it's never too late to start putting more emphasis into this. And yeah, it's not that easy at the beginning, but the more you do it, the easier it becomes in terms of eating healthy. But I think that women going through menopause can have a real important role and have a lot of influence over their lipid profiles and sort of risk for cardiovascular disease just by their lifestyle. And
Yeah.
so that's an even more reason, because of like the changes that menopause create with your microbiome, taking hormones or not, it's so important to compensate for that increased risk of cardiovascular disease that happens.
Yeah, I think it's great that you mentioned that you can actually change your gut microbiome, and just by the foods that we decide to eat, and that it only takes a few weeks. It doesn't take like years
Years,
to
yeah.
see that difference, right? So if we just be intentional about what we're eating and what we're putting into our mouths and in our plates, it can really make a huge impact in our health. And we don't have to wait years to see those results, right?
Right.
We'll see that in a few weeks just on how we feel, and we might start to feel better.
The body has an incredible regenerating capability. It's like amazing. Like the body is really adaptable in so many ways, that it's not really ever too late to start implementing healthy behaviors. Um, so it's pretty incredible, like that. Not only is not only is our body really, um, it's just like when someone stops smoking for like a couple of weeks, like immediately their like airway capacity and all the immune systems start to decrease. Like I forget the specific but I remember, like, it's pretty impressive when you sort of start um, consistently implementing more healthy lifestyle, your body responds to it in a pretty impressive way. And that's important too, because I think, especially those of us who potentially carry high risk genes for things, or, I'm personally very predisposed to diabetes. It runs a lot of my family, which is sort of how I got into this whole thing of lifestyle and nutrition. But I think I want people or women to know that, you know, it's definitely lifestyle is really can influence so much and potentially even cause those genes that you're predisposed to be down regulated. So it's not like I'm doomed to get diabetes, or I'm doomed to have heart disease because both my parents did. Not necessarily. Like, you have more power than you realize over your own health.
Yeah. I like that. You mentioned that there's always room for change and that there's always hope, right? I think a lot of times when we look at our family histories, we may see that there's heart disease, there's high blood pressure, there's diabetes. And so, are you just going to be following that same route? And that doesn't necessarily have to be true. I think also what we see in, you and I know this, in OBGYN, right? I feel that it's amazing when a woman gets pregnant. It's almost like looking into her future, right? In the
Yeah,
sense that, if she gets a high blood pressure in her pregnancy, then she's at a higher risk of developing hypertension later on in life. If she gets diabetes in her pregnancy, she's at risk for getting diabetes later on in life. And that actually is a huge opportunity for those pregnant women to make lifestyle changes so that they don't end up with diabetes, so that they don't end up with
100%.
high blood pressure.
Totally.
And I think that, if we really kind of lean into that for our patients, we can really help them in really advocating for preventative medicine and preventative lifestyle.
Totally. I ask every single patient I see who's been pregnant, did you have diabetes? Did you have hypertension? Because even if they don't now, like you said, they're predisposed, and there's things that we can do to prevent that. Interestingly enough, too, um, in studying lifestyle medicine, there is I have to look up the reference because it's such an interesting study that I have quoted a few times, but people that are more like, let's say you're someone who you're like, I've never been healthy, I've never been fit, I'm 55, and what's the point? Like, I'm so people that are the most, I guess, unhealthy or have the most weight to lose or have higher BMIs actually are the ones who gain the most benefit for the shortest increment of effort. So,
Mm,
like, it's like there's like this, it's, I always, it's basically like, um, if you can sort of consistently do like 20 to 30 minutes of exercise a day, and let's say you've never exercised in your life, and you have a lot of weight to lose, you're going to benefit from more downstream health um, positive effects than someone who is actually more fit and doing the same amount of exercise. I mean, it's all good. And for me, exercise is like the magic pill that, you can never do too little, like, especially in some of my patients who just don't have any interest in exercising, or they don't want them, like, literally 5 to 10 minutes a day. Just do 5 to 10 minutes a day. It adds up over the days. Um, but that's so interesting because I feel like I want women to know, especially if they're overwhelmed and they're like, oh, but my whole life, I've been overweight. Everyone in my family's overweight, and I'm like, you don't even have to do that much, and you'll benefit a lot.
mm. That's, that I think is very empowering to patients,
Yeah,
right? Know that, especially, I think that people kind of get into the mindset that they get a little bit stuck in the sense that, they feel like they've always been overweight, or that they've all of a sudden become overweight, right? That perhaps they
yeah,
weren't before. And now, due to whatever circumstances, perhaps they're so busy, perhaps they have a job where they have to sit all day long, that they have gained all this weight and don't know what to do. And then instead of giving up, you tell them that, if you even do just a little bit, you'll gain the most benefit. I think that's very empowering. Do you find that and I'm just curious, this is just for my own knowledge, that those patients that have a lot more to lose, that when they start to lose weight, do you believe that it improves their metabolism when they start to lose weight? Or do you think that that just is a function of them exercising more and that's why they're losing more weight?
That's a good question. I'm not sure. I definitely know like the of anything sort of resistance training is going to increase your metabolism more. But I don't actually know the answer to whether like losing the weight itself it revs up your metabolism. I would assume so, but I'm not really sure.
Yeah, I don't know either, and so that's why I was just curious if you,
But like
yeah.
a lot of women, you know, tend to put a lot of emphasis in cardio exercise, which is important for heart health. When, but it's sort of, yeah, I think people are realizing a lot more how the importance of resistance training. But resistance training and lifting weights is completely different than running several miles, and it is so crucial for women in midlife to incorporate resistance training for a variety of reasons, including a prevention of osteoporosis. We lose improvement of insulin resistance because when we lose skeletal muscle mass, we lose insulin receptors. Insulin receptors are highly concentrated in skeletal muscle. So when we women lose about 1% of muscle mass a year starting in your late 30s. And so that adds up over time. And that's why you start seeing, that's why you can't eat everything you used to in your 20s. You don't have as much skeletal muscle and insulin receptors to metabolize that sugar as efficiently. And you need more and more insulin. So that, and then with resistance training, you tend to, it does increase your metabolism because you are burning, your muscle are still sort of burning and working even after you've stopped working out, as opposed to when you're running. The So anyway, it's like there's just more and more research that shows that it's so important for women in midlife to incorporate resistance training. Even can help with sleep, actually.
That's fantastic. I had no idea that when you lose skeletal muscle mass, that your insulin receptors go down, and that's why a lot of women will become insulin resistant as they get older, and specifically even in menopause. Right? We know that we lose muscle mass, and I feel like it almost accelerates when we go through menopause.
No, it
And
definitely does. Yeah.
yeah,
You tend to have more of that redistribution, like you were talking about, of fat. Your body shape changes, and we tend to have more visceral fat, which is more of a risk factor, as you know, for diabetes and cardiovascular disease. But the resistance training can really help slow that down.
that is fantastic. So, what would be some pearls that you would love to perhaps leave with our people that are listening and viewing and watching this episode? What are some key pearls that you would tell them as they go through life?
You know, I would say that it's number one, it's never too late to strive to make tiny little changes. It doesn't have to be grand, it doesn't have to be huge stuff. With lifestyle, li- healthy lifestyle is effective in small changes are effective as long as you do them consistently, but it can be very small. And I think the other way to think about it is like mindset is everything, right? So like I never really try to tell my patients like don't eat this, don't eat that. I mean, of course I'll mention sugar and processed foods, but in general I try to just say incorporate more to your plate, incorporate more interesting foods or try new things, just because it's a mindset of like just in nourishing yourself, nourishing your body and your mind more than sort of depriving, because you know that's not fun. Um, and and then you know, seeking out ways to help with stress reduction. I think that is something I'm starting to do more research on, but I think that we don't have enough great tools. Um, but I think, and I don't think we talk about it enough with patients, but stress is really implicated in so many ways in our sleep, in chronic disease. And so whether you know, movement and being outside tend to be some of the best ways to decrease stress. You know, with lifestyle, it's like, it's really simple stuff. It's really simple stuff. You know, you don't need like crazy expensive gadgets or, you know, you don't have to go to an expensive med spa. You really you get so much benefit from the simple things of walking outside, you know, eating something nourishing, um, being outdoors, being in nature. There's like a lot of research that shows that it's so beneficial to lowering cortisol and helping decrease stress in like a ripple effect. And then just, yeah, I guess just eating, trying new foods.
Yeah, no, that's great. And I agree with you. I think actually I heard on NPR one time about doctors actually prescribing outdoor therapy, like, having
Yeah.
patients go outside for like 10 minutes and literally
Yeah.
writing them a script.
That's a lifestyle medicine thing. So that is, I don't do that, but that is something a lot of lifestyle medicines doctors do, is give a script for like being outdoors for 10 minutes. It really just doesn't take that much. And sometimes I feel like we complicate everything, um, and it's hard, but you can go outside with kids, you can go outside with your pets, you can, be outside alone. Being outside has a lot of benefits. And eating healthy takes a little bit more effort, but if, the more you do it, and if the more you do it, the easier it becomes, I guess.
Yeah. Yeah, fantastic. So, for those viewers that are wondering, oh, I loved listening to Dr. Alicia Robbins. Where can I follow her? Where can I find her? How can they get in touch with you?
Yeah, so I'm on Instagram at Alicia Robbins MD, and I am not on TikTok yet, but I probably will be soon. And then um, my website is theelmgreenwich.com. I can do telehealth in Connecticut and New York, but also just follow me on Instagram. And thank you so much for having me, Dr. Sadaf. This was so great.
Yes, thank you for coming on. I learned so much, and I'm sure the
Oh,
viewers did
good.
as well. Yes, they're all this about the gut microbiome and how important it is to actually help with the absorption of estrogen. I had no idea. So, all good stuff, and about the skeletal muscle mass that we lose, which we know we lose, but is
Yeah.
really the importance of doing resistance training, which, as we all, hopefully, we all get the privilege of getting older, we'll have
And
to increase that.
And I'll say one more couple. I just thought of a couple more pearls,
Yeah,
if that's
yeah,
okay.
I love it.
I think not, you don't need to spend. It's probably better to spend money on like real food than like expensive probiotics.
Mm.
Um, there's a lot of really expensive probiotics out there, so it's hard to really apply. There's so many, it's hard to really study all of them. But most of the studies show that eating like the real food is better than taking expensive probiotics. And if you do take probiotics, you have to be really consistent about it in order to actually get colonization. Um, and then the other thing I just want to say, because we're talking about microbiome for women, especially menopausal women, I get asked a lot about vaginal, like sort of dealing with the vaginal microbiome. One of the best ways to treat a vaginal microbiome, because also in menopause, the the diversity decreases, and you don't get you sort of the normal acidic environment of the vagina goes up. You have a little bit more pain, dryness, irritation. The best way to treat that is actually vaginal estrogen. Vaginal estrogen has been shown to help maintain a vaginal pH or microbiome better than vaginal probiotics. So, if any of those listeners are suffering from vaginal irritation or dryness, talk to your provider about vaginal estrogen to help with that.
Fantastic. I had no idea. And, we know, you and I both know how important vaginal estrogen is, especially in menopause. And it helps with, like you said, it helps with increased lubrication, prevents the itching, the dryness, recurrent UTIs, helps with bladder health, helps with a decrease in friction in terms of painful sex. It also is just so good all the way around, and it helps prevention of regression of the labia minora.
Mm-hmm,
And
mm-hmm,
it really helps to maintain our vulvar health. So one more reason to be using vaginal estrogen is
mm-hmm.
to maintain that vaginal microbiome, which is excellent information to know. So
Yeah, you don't need to spend a lot of money on a vaginal probiotic. Just get vaginal estrogen.
Excellent. Well, thank you so much,
No,
Dr.
thank you. This is
Robbins.
great.
So yeah, we really appreciate having you on. And it's been real and really intimate. And remember, this is not meant to be any type of medical advice. So if you're having any issues or concerns, please speak with your friendly neighborhood healthcare provider. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.